Welcome to Rumor versus Truth, your trusted source for facts, where we dissect the evidence behind risky rumors and reveal clinical truths. Today, we'll take a bite out of dental-related myths.
Hey Steve, did you know that October is Dental Hygiene Month?
I did not.
Yeah, I was looking at it and how are you expected to celebrate that? Am I supposed to give my dentist a gift?
Well, frankly, Don, don't they have the tooth fairy for that? But I am curious, now that you asked this, what would your gift be to your dentist?
I don't know, like a plaque maybe.
Mine would probably be my insurance premiums. It's the gift that keeps on giving.
I know. Tell me about
And
it.
as our dentists in the audience are filling out their wish list, I'm Steve the pharmacist.
And I'm Don the pharmacist.
And in this episode, we're celebrating Dental Hygiene Month by sinking our teeth into claims involving medications and other products that affect oral health.
All right, and new for this month, this podcast offers continuing education credit for pharmacists, pharmacy technicians, physicians, and nurses subscribed at our platinum level or higher. Just log into your pharmacist letter, pharmacy technician's letter, or prescriber insights account and look for the title of this podcast in the list of available CE courses.
Yeah, very excited to be offering CE now. But that also means we need to add a little more info here and in the show notes. So, for the purposes of disclosure, none of the speakers have anything to disclose.
Yeah. And don't worry, folks, even though we're adding CE, we are still keeping our tongue in cheek puns you love, especially for this episode.
Very true. And what's also true is that over 4 in 10 US adults over 30 have some form of gum disease, which surprised me. And pharmacies have whole aisles dedicated to dental health supplies to help with this. Things from toothpaste, toothbrushes, mouthwash, you name it.
And dental disease doesn't just mean cavities and tooth loss.
True.
Periodontal disease is linked to things like heart disease and even cancer. And I saw a study that showed almost half of the community pharmacists feel they lack enough knowledge on or health to provide advice to patients. Looking at some of these claims out there can help pharmacists and other professionals fight tooth and nail against dental disease.
Good one, Don. And while we unpack these claims with our fine tooth combs, stick
I got
around.
you.
We'll also answer a listener's question about testosterone from our last
Sure.
episode.
Okay. So let's go and jump into that first claim, right? I think this is on many people's minds during recent headlines. And the claim is fluoride toothpaste and mouthwashes are harmful. There's been a lot of headlines on fluoride lately. For example, FDA is revisiting industrial fluoride products on the market, leading to similar questions about fluoride toothpaste and mouthwashes. And to help us with this claim, we reach out to the dentist expert, Dr. Jason Chalmers, DDS. He also happens to be the dentist for Matt, our podcast producer. Don't worry, Matt. We didn't ask how well you've been flossing, at least on camera, but we did ask about concerns with fluoride products. Let's see what Dr. Chalmers had to say. So, Dr. Chalmers, the first one I have for you is fluoride toothpaste and mouthwashes are harmful. What's your take on that?
Yeah, fluoride has been used for many years and very important in the dental field, right?
Yeah.
I think anybody who's been to the dentist, even if you haven't been to the dentist, you know fluoride exists and kind of what it's for.
Right.
So, harmful or beneficial? The answer is yes on both. It can be harmful and it can be beneficial. Uh, I think as long as it's used appropriately, like any medication in the right dosage,
Mhm.
the right application, it should be absolutely 100% safe. Really, it's a well tested medication that we use every day in our practice. So, most toothpaste over the counter that you're going to see
Mhm.
have about 900 parts per million. This is
Okay.
your Colgate, your Crest. You're going to be using those on a daily basis,
Sure.
and and you're going to be brushing with that a couple times a day, applying it to the teeth, and
Mhm.
that's usually enough for most people
Mhm.
to help strengthen the teeth, remineralize the teeth, protect
Gross.
them
Okay.
from cavities forming. Right.
Mhm.
Occasionally, people might need a little bit more. Maybe their teeth are a little softer. Maybe they're got food traps in there,
Mhm.
recession. Their roots are much softer than the crown of the tooth, so the roots get cavities much easier.
Sure.
So for those people, we'll prescribe a prescription toothpaste sometimes, and those will come out like we talked earlier about this about the number 5,000. What does that mean in
Mhm.
toothpaste? Your
Mhm.
Prevalent 5,000 or this five. That's 5,000 parts per million,
Mhm.
about 5 times stronger than your over the counter toothpaste. So that's what it's for. Um, real quickly, when you're brushing with these things, you're going to apply it at least once a day on the prescription toothpaste, twice a day
Mhm.
for your over-the-counter toothpaste.
Gotcha.
You're going to brush for 2 minutes. You're going to spit it out, and you're going to not rinse or do anything for I like about a half an hour afterwards. So no water, no wrinkling, no food for about a half an hour after you brush with these, especially these prescription strength toothpaste. Let them do their work. I often tell people it's a lot like applying sunscreen on your skin. You
Mhm.
wouldn't apply it, wash it off immediately. You're gonna let it sit for a little bit. And I believe you guys had a podcast about sunscreens recently, I think, right? Apply it every 20
I think.
minutes
Mhm.
or 20 minutes before you get in the water, and then if you
Mhm.
swim, every couple hours, right?
Right.
So I was listening to that, and kind of the same thing. Treat the high fluoride toothpaste like that. Put it on, let it sit for a while before you do anything. Okay.
Okay, I do like that as a
Um,
consultation point because I think a lot of when we get those prescription toothpaste in the pharmacy, uh, it'll say use as directed or whatever it may be. So the patient may just, okay, I brush my teeth with the fluoride. I'm going to wash my mouth out immediately with water to get it off, and
yeah.
it's good to go. But you're saying nope, leave it on there for a
Leave it
certain
on
amount
for
of
a
time.
little bit.
Okay,
Yeah, yeah.
good.
So, and even your over the counter toothpaste,
Mhm.
it's better to leave it on. Don't rinse it off.
Okay,
And I
good,
I
good.
I I have to look. I haven't looked at one of the labels in many years because you kind of just get the
Mhm.
tube, you use it, and forget about it.
Right.
But I believe it doesn't say rinse on most of them. I think it
Okay.
says to expectorate, and that's it. So spit it out, leave it. So even with my over the counter toothpaste, and what I do is I actually switch back and forth. I'll do an over the counter usually in the
Mhm.
morning. I'll do a prescription at night. That's kind of how
Okay.
I do my levels of fluoride. But yeah, don't rinse with either one of them. Yeah, it's better
Perfect.
not to.
Perfect.
Just leave
Okay.
it. It's a little awkward in the beginning, but people get used to it.
Perfect. Yeah.
So
I also know that they were planning to remove some of those prescription ingestible fluoride products. I believe, like the
yeah,
tablets. I'm
yeah.
sure
The
you
end of
probably
this
know
month,
that.
actually.
Yeah.
Yeah,
Mhm.
end of this month, the HHS is saying that we're going to get rid of those ingestible fluorides that maybe you and I would have taken when we were kids. We would have
Mhm.
taken the little tablets, kind of sweet. It's basically just a fluoride tablet. Most dentists haven't prescribed those for a decade or two. It's
Mhm.
been a little while, and you're probably not seeing it much on your side either.
Yeah,
Um,
I can see that.
and I think for the most part, that's probably in our industry okay. People are getting fluoride from other sources. They're getting it
Okay.
from their toothpaste. They're getting it from their water, their community water. So having it in your community water, having it in your toothpaste, you don't need as much on of a prescription
Mhm.
strength as you used to. Yeah. So,
Perfect.
but it's
Perfect.
still a big benefit to some people. So,
Okay, got it. All right. Well, thank you very much for that fluoride overview and all that great
absolutely.
information. I'll take it back
Yeah.
to
Yeah. Sure.
Steve and see what he has to say. Thank you.
That was great. I liked Dr. Trommel's point about how these products are safe when used according to their directions. That's really key. After
Hmm.
all, fluoride toothpaste shouldn't be ingested. And you could say the same about fluoride mouthwashes, right?
Hmm.
If you swallow these products consistently, fluoride levels can build up and cause fluorosis, including dental fluorosis, which I looked up and says that this is where enamel can develop discolored flecks, spots, or lines even in the teeth. So, pretty serious
Right.
stuff.
Yeah, sounds like it. And that's why kids should use small amounts of toothpaste when brushing, since they're more likely to swallow toothpaste by accident. For example, talk to a dentist before using fluoride toothpaste in kids younger than 2, and use the size of a grain of rice when kids are 2 to 3 years old, and the size of a pea from 3 to 6 years old.
Nice.
Yep. So let's go and go back to that claim. And it is fluoride toothpastes and mouthwashes are harmful. And the verdict is rumor with conditions.
Right. So before we badmouth fluoride toothpaste and mouthwashes here, it is important to really put that into perspective, right?
It is. Yeah, right. So dose is everything when it comes to meds. These products are safe when used according to their directions. We can provide these helpful tips on correct toothpaste and mouthwash use, especially to help patients limit fluoride risks for kids, and advise adults to read product directions carefully for safe use.
Great tips there, Don. And speaking of mouthwashes, you may have heard this next claim that alcohol based mouthwashes should be avoided with metronidazole. And I remember being taught mixing alcohol, even in mouthwashes, with metronidazole, a common antibiotic, can cause a disulfiram reaction. And
Mhm.
that's where a patient can get flushed, sweaty, nauseous, and may even throw up from that
Mhm.
combination. And we know mouthwashes can contain high amounts of alcohol, sometimes almost to a 30% concentration,
Oof.
which is about the same alcohol content as some vodka brands, believe it or not.
Yep, good old 60 proof mouthwash, right?
Let it rip.
Yep. And in fact, there is thought that this reaction could occur with alcohol up to 3 days after stopping metronidazole.
Yeah, so it's not just immediately gone once
Mm.
you stop it. And
Yeah.
it's been questioned, though, whether this alcohol metronidazole interaction is really that big of a to do. The
Mhm.
incidence isn't, frankly, very clear. It appears very rare. Plus, reactions vary amongst patients, they don't all have the same effects. And
Mhm.
even in the Center for Disease Control's 2021 antibiotic guidelines for sexually transmitted
Mhm.
diseases, they mentioned that avoiding alcohol while taking metronidazole or a related drug, tinidazole,
Mhm.
is unnecessary due to
Oh,
lacking evidence, which I found
mhm.
surprising.
Yeah, me too. Especially since, as we've learned, ingrained in pharmacy school and beyond,
Right.
right? And it's important to point out mouthwashes generally shouldn't be ingested.
Right.
Absorption through the mouth from a quick swish and spit isn't expected to cause significant systemic levels,
Yeah, and I couldn't find any clear-cut published cases of these disulfiram reactions from metronidazole and alcohol-laden mouthwash.
though.
It's mostly with cases using recreational alcohol that you're supposed to consume. So
Okay.
keep in mind, it's possible that nausea and vomiting here in these patients
Mhm.
taking metronidazole is due to the med itself, possibly not the interaction. So with all that in mind, this claim that alcohol-based mouthwashes should be avoided with metronidazole, the verdict is rumor. Ethanol exposure from mouthwashes is low, like Don said, when used appropriately, and metronidazole's interaction risk seems dubious in this
Mhm.
scenario. And if you're always concerned about that risk, you can steer patients to alcohol free
Mhm.
mouthwashes, which might be a good idea to help decrease mouthwash side effects, even such as dry mouth and oral pain. So think
Yeah, that,
about that.
that fun sting that alcohol you usually can bring in a mouthwash, right?
Right,
Yeah.
exactly.
But we should specify that alcohol drug interactions should still be considered if ethanol is actually ingested, since blood levels will be higher in those cases. Check out our alcohol and drug interactions chart online for a handy list of possible combinations to avoid.
Yeah, I'll toast to that reference, Don. So take a look at the show notes or description. We've linked directly to that chart and a few others related to this episode for easy access.
And if you already aren't a subscriber, don't miss out on these resources. Sign up today to stay ahead with trusted insights and tools. And if that wasn't a pain, brace yourself for this next claim. Patients need prophylactic antibiotics before most dental visits. Uh, I think we may be used to seeing rounds of antibiotics, like 2 grams of amoxicillin before dental procedures. But a study of nearly 170,000 dental visits determined 80% of antibiotics prescribed before dental visits to prevent infection are unnecessary. And we know that antibiotic overuse can lead to bacterial resistance. And we know that even a single dose of clindamycin can increase the risk of diarrhea from C. difficile infection.
Yeah, really good point there. So when are antibiotics actually needed during a dental visit then?
Well, you know what? I brought our dentist back to
Great.
kind of Dr. Chalmers about this claim to see what's happening in practice. Here's what he had to say. My pharmacist colleagues are still saying we're seeing a lot of prophylactic antibiotic dental prescriptions come through for a lot of patients, and this is a kind of important claim to address. So, what are your thoughts on this?
Oh, great. Well, thanks for having me.
Sure.
Yeah, we are not seeing in the dental field as many prophylactic antibiotic cases as we used to. They've really kind of scaled them down over the last decade or two. Now it's very few cases really. And the two things we're mostly worried about are artificial joints and infective endocarditis. That's kind of the reasons we do the prophylactic antibiotic in the first place. It's typically given between 30 and 60 minutes before a dental appointment. And again, it's with somebody who's really just a high risk for either losing a joint or a new joint, or they've had endocarditis before. They're at risk of getting it
Okay.
again for whatever reason. Sometimes it's an artificial valve. Sometimes it's the regurgitation, like the blood flow isn't really
Mhm.
laminar and smooth through the heart, and it eddies and pools. And for people who have had an artificial valve, or a stent or something placed like that, or they've had a heart transplant. These are patients that's for some time until they get that laminar blood flow back again, or in some cases they never get it back. Will be on prophylactic antibiotics before a dental appointment. So we're basically doing it for those two reasons: for at-risk joints, like somebody, let's say, had an artificial hip placed, it became infected immediately after, and the orthopedic surgeon's really nervous about this joint. So I'm really scared that it's going to fail for some reason. So that's a person that, and the way this works is usually it's the orthopedic surgeon who's going to tell us in what case it needs to be done, or the cardiovascular doctor or surgeon will tell us when it needs to be done. So we're not making that determination on our own here at the dental office. We're kind of being told by somebody else, this is a good candidate, a patient who needs this. Does that kind of make sense?
Right. That's good to know. And I like the cardiovascular lesson and the dental lesson all in once in that particular claim.
Yeah.
So when you do need to prescribe antibiotic for that patient subsets, what do you tend to lean towards?
Amoxicillin has been our go-to for many years. Traditionally, it had been clindamycin if they were allergic to amoxicillin or penicillin or something in that family, right? But recently, they've gotten away from the clindamycin because of a C. diff issue in the intestines, right? So they've steered away from that now. And we're kind of going towards, if you're allergic to penicillin, maybe something like a cephalexin, or you're going to be at azithromycin, maybe, let's say. So that's pretty traditional now, as we're going from amoxicillin, if you're allergic to that, to cephalexin, or to azithromycin. So that's where we're at. So that's the medications we use. They're typically given 30 minutes to 60 minutes before, the visit. Here's a good point. If they're already on an antibiotic for another reason, let's say somebody was on amoxicillin, they had some other respiratory issue or something, their MD places them on amoxicillin. We still want them on a different antibiotic, even though they're on that one. We just want to choose a different class. So we would use then like azithromycin. That's for me, azithromycin's an easy go-to. It's a pretty easy drug on the gut. So I'll usually pick something like that and say, okay, take this azithromycin 60 minutes before you come to the office, even though you're already on amoxicillin. But that's how they're kind of working that these days. So, yeah.
I like that point you made about them being an antibiotic, and they need a different antibiotic for this. So that's a point I didn't even think of, but definitely a key information to give.
It
so
is.
It's
important.
Yeah.
It is important. Yeah. Because these are really at-risk people. These aren't people who are usually super healthy. They're coming in, they've had an infective endocarditis, they've had a heart transplant, they've had a valve or a stent placed. We got to be really careful with these patients. The bacteria from our mouths gets into our bloodstream very rapidly. Years ago, there was a study about they took people with periodontal disease, bad gum disease. They tested their blood, anticubital, right? They took it from the arm. They had them eat. 10 minutes later, they tested them again after eating. All that bacteria from the mouth is found in the bloodstream within 10 minutes after eating. So if you have gum disease, you're getting bacteria that doesn't belong in your bloodstream, causing who knows what, all kinds of inflammatory processes probably. So it is very important to be careful with these people. Yeah.
Appreciate it. Well, thank you. Thank you, doctor, for information. I'll kick it back to Steve and see what he thinks.
Great. Thanks for having me.
Nice. Now, Don, my first thought was all this talk about mouth bacteria in the blood makes me want to go brush my teeth. But seriously, those points were great and really aligns with guidance from the American Dental Association, which only recommends antibiotics in certain cases before dental work, specifically for patients with the highest risk, things like prosthetic joint infection or endocarditis, that they're really at high risk of that.
And those with prosthetic joints who have multiple risk factors as well. So immunocompromise, A1C over 8%, things like that. And those with prosthetic heart valves or some types of congenital heart disease.
Right. And even then, it's not every single dental procedure or dental visit, right? It's really to save antibiotics for dental procedures that involve the gums or soft tissue, like teeth cleaning or extractions, things like that.
Yep. So let's go and take it back to the claim, which is patients need prophylactic antibiotics before most dental visits. And the verdict is rumor. So this is quite the mouth myth now, but don't run off to brush your teeth just yet,
Oh,
Steve.
darn.
Yeah, we still have 2 more claims here.
And you could say I'm chomping at the bit, Don. But
Mhm,
seriously, dental prophylaxis is a great opportunity for antibiotic stewardship to help limit that resistance
mhm.
Don was talking about. So use our resource, Antibiotic Stewardship Toolbox, for more tips on when to save antibiotics for when they are really needed.
Alright, and that resource is also directly linked in the show notes. And don't forget, you can now get CE credit for this episode. And you guessed it, all that info is in the show notes as well.
Yeah, those show notes are super helpful, and you should definitely take a look at them. And listeners may also be aching to know the facts behind this next claim that putting aspirin directly on a tooth can help cure a toothache. Now, we know that aspirin can help relieve pain when taken orally, and people may think putting it directly on the tooth can locally relieve pain without causing any systemic side effects like bleeding that we sometimes associate with aspirin.
Mm.
But there's little to no clinical evidence supporting this that this actually helps with tooth pain. I only found one related study all the way back from 1983 looking at an experimental aspirin solution to decrease oral pain, and it was only in like 11 patients. And even then, the authors in that study said don't put aspirin on a tooth directly.
Okay, well, why not? My
Yeah, it
teeth are really bad. Why not, Steve?
Right. There's some cool chemistry here. Aspirin is acidic. And if you keep putting it on a tooth, it can actually wear down enamel and also even lead to chemical burns on the gums. And I was able
Mm.
to find multiple case reports of patients trying this home remedy, and it was actually causing more gum damage. So you're actually likely to cause more pain by doing this. So, with this claim that putting aspirin directly on a tooth can help cure a toothache, the verdict is rumor. This claim sounds like a home remedy that is long in the tooth. Have you ever seen a patient actually do this, Don?
No, not at all, thank goodness. And we should steer patients to evidence based approaches for dental pain.
Right.
First, obviously, is getting the issue looked at ASAP by a dentist to see if there needs to be surgery. But you may be asked about pain control until then.
Right. For example, recommend teens and adults take a non-steroidal anti-inflammatory drug or an NSAID, things like ibuprofen, with or without acetaminophen first line. And folks, you do need to take these orally, not topically, please. I saw someone make a good point on this. You wouldn't put aspirin on your forehead for a headache, right? So we need to make sure we take these meds by mouth. And patients can also temporarily use topical benzocaine products, but these really should not be used in kids under 2 due to increased risk of blood disorders.
Yeah, good point there, Steve. Thank you for that. And use our handy chart, analgesics for acute pain in adults, to review tips on safety using NSAIDs, acetaminophen, and more.
Right. And before we get into our next claim, a quick reminder if you're enjoying this episode and want access to even more clinical insights, check out Pharmacist Letter, Pharmacy Technician's Letter, and Prescriber Insights. As a listener, you can get 10% off a new subscription with the code RVT1025 at checkout.
Okay, let's talk about something that actually puts bad taste in people's mouths. So buckle up here. And the
Let's
claim
do it.
is sublingual or buccal buprenorphine is linked to tooth decay and cavities.
Mm,
So we do know sublingual and buccal. Buccal means you park it inside the cheek where it's absorbed through that area.
right.
Uh, those versions of buprenorphine and buprenorphine naloxone are commonly used to treat opioid use disorder or OUD.
Right. And I remember FDA released a statement in 2022 when they noticed an uptick in dental issues
Mm.
such as tooth decay, cavities, infections, and tooth loss, even in patients
Mhm.
taking these meds, even those who didn't have any
Yeah,
previous dental issues.
that's true. And even more recent evidence suggests that this can indeed be a risk with these types of buprenorphine.
Mm.
It's possibly because of buprenorphine's acidity causing tooth erosion, but it's still hard to say.
Yeah, it kind of reminds you of the aspirin we were talking about, but
Yeah, yeah.
we should put it in perspective, right? These medications can save lives by
Mhm.
treating opioid use disorder. And these dental issues were reported in only about 300 cases out of 2 million patients taking buprenorphine in 2022. So, this dental issue is not a reason to withhold
Mhm.
treatment or suddenly stop taking buprenorphine for opioid use disorder.
Yeah, good follow-up there, Steve. Thank you. And going back to that claim, it's sublingual or buccal buprenorphine is linked to tooth decay and cavities. And the verdict is true.
Yeah, so the side effect is not as rare as hen's teeth, but the risk is still pretty small compared to the benefits we were talking about with buprenorphine.
Okay. Before we get to more science, I need to go back to what you just said, Steve.
What?
Uh, Rare as hen's teeth. I'm gonna need you to explain that one.
Oh, well, I think we'll have to get Dr. Chalmers on the line because I'm not a veterinary dentist, but I am from Iowa. So
Okay.
keep that in
Okay.
mind.
Okay. Enough said. You're good. All right. And pharmacists can counsel patients taking sublingual or buccal buprenorphine on good oral hygiene to prevent disease. After the medicine has completely dissolved, patients should gently rinse their teeth and gums with water, then swallow. And patients should wait at least 1 hour before brushing their teeth. Getting regular dental checkups is also key to monitor for issues.
Yeah, and good for just general dental health.
Mhm.
And you could read more about using buprenorphine and other meds for opioid use disorder and
Mm.
pain using our Management of Opioid Use Disorder resource online.
Cool. All right, let's go ahead and drill down to that bottom line truth, right? So, medications can have a large impact on oral health. Healthcare professionals can help patients sort through treatment options and ditch those risky home remedies.
Yeah, quite a mouthful of myths with this episode, Don. And now I want to schedule my own dental appointment as a
Yeah,
result
me
of
too.
that.
Yeah, I think I'm going to call him after this. But you took the words right out of my mouth, Steve. And our dental colleagues can be an excellent resource on oral health questions to keep our pearly whites shining bright.
Yeah, and speaking of questions, you reminded me it's time for the Rumor versus Truth mailbag.
Mhm.
We have an audience question from the last episode about testosterone claims, and one viewer sent us a text from the link in the show notes and asked, I saw a news article saying studies show drinking carbonated beverages like cola will increase testosterone levels. What's your take?
Well, we found the study that the news article referenced. Get this, drinking certain cola drinks may increase testicle size and testosterone production, the study says. I almost spat out my pop actually reading that.
Okay, so you can't judge me for saying hen's teeth if you're going to start pulling out pop like that.
Well,
That's
you
so
rub up on me,
Midwest
so it's
stuff.
fine. Yeah, we're becoming one mind.
And personally, I think that there's little chance that this claim is clinically true.
Yeah. Well, the study they were mentioning is from 2022
Okay.
and dived in a little more. They gave mice water or varying amounts of Coca-Cola for 15 days. And they harvested the testes from the mice and ran tests on their testosterone levels and receptor production. They found increases in all of these in the Coca-Cola group.
Yikes. I'm glad we didn't run this kind of experiment in humans, Don, but
Mm.
that is the kicker. This wasn't performed in humans at all.
Mm.
It didn't look at outcomes we want from testosterone therapy, like increased libido, muscle strength. So, a very preliminary study. And we know drinking too many sugary soft drinks can actually have downsides that we know
Right.
about, such as obesity, type 2 diabetes, and things like that.
Yeah. So don't bank on soft drinks boosting your testosterone levels.
Right.
We don't have the data in humans, and the evidence we do have about soft drinks suggests it's not worth that nutritional risk. Well, that was a unique question, Steve. And remember, folks, we also use your suggestions to plan our episodes. So please, please, please keep them coming.
Yeah, and if you got a dental dilemma or a rumor that's been gnawing at you, send it in. Maybe we'll take a bite out of it for our future episode. And email us at rumorversus@trchealthcare.com or send us a text right from the podcast show notes.
And we know you've got some great ideas for us to demystify.
Yeah, I bet someone's going to ask what Matt's dentist will want as a present for Dental Hygiene Month.
I think he told us actually.
Oh.
At the end, he said he just wants more people to floss.
Okay, that's definitely a dentist answer. But I'm so glad he could join us. And if this episode gave you something good to chew on, be sure to follow, rate, and review Rumor versus Truth wherever you get your podcasts. And of course, check us out at trchealthcare.com.
You can also help grow our show by telling a friend about the awesome things you've learned about and where you found us. And a quick reminder for our special 10% discount we mentioned earlier, just use the code RVT1025 when you check out.
Yeah, and if you're a student, even better, students can access a free version of Pharmacist Letter. We've got links in the show notes that take you directly to the right places to take advantage of these awesome deals. So go check them out.
Also, don't forget, you can also get CE credit for listening to Rumor versus Truth.
Yeah.
If you are a platinum or diamond subscriber, click the claim credit link in the show notes and search for it in the CE organizer. And join us next time where we'll take a look at cold and flu claims with natural meds.
A timely topic that is nothing to sneeze at. So
Getting
thanks
those
for
puns
joining
ready.
us. You betcha. And thanks for joining us on Rumor versus Truth, your trusted source for facts, where we dissect the evidence behind risky rumors and reveal clinical truths. We'll see you next time.